Meet Carina, a division manager at Mittköping Hospital in Region Mitt. Carina's primary responsibility is to look after her patients and their well-being. That is where she wants and should spend her working hours. Unfortunately, that's not what her everyday looks like, as Carina is also accountable for scheduling the department's resources. Every 10 weeks, Carina starts over by manually extracting data from the HR system and move the information into her Excel scheduling sheet. Despite the fact that Mittköping Hospital has 2 employees working with the system's backend, there are no links between different shifts in the HR system, nor the Excel, and Carina needs to import and manage the employee information manually. In parallel, different departments may make manual updates to the shared Excel, increasing both stress and risk of errors. The document can be locked for editing or saved with a new name, which makes it impossible to know which document that holds the latest information. On top, Carina can't add any intelligence in terms of skills and competences of nurses when making her schedule. The end product of Carina's work is not the Excel, but the print-out version on a billboard displaying a calendar view of days and the names of the staff members by shift. Now, let's say a colleague of Carina, Nurse Andres, wants to swap day with a fellow nurse. Andres has no overview of open shifts and no easy way to change shifts or offer shifts to a colleague. He needs to turn to Carina for help. 80 hours has already been spent to create the first batch version of the schedule when Andres contacts Carina to help make a change. Carina manually opens up her Excel and looks for available shifts. But as her Excel is not connected to employee information, she has to manually call the available nurses to make sure their competences make a match with Andres. Consequently, changes are being agreed and approved via conversations, text messages, email, phone, and hopefully documented in the Excel. Worst case, on the printout on the billboard or not at all. Now, where is that automated tool with an updated schedule that Carina, Andres, and the rest of the staff could have on the go when they need it? Is it really so hard to automate? Let's find out. 10 weeks have passed. Time to make that schedule again. Carina is happy, as she has just learned how to make best use of her new scheduling application. The employee database now holds all required information on competences, contact information, and availability. All planning documents are synchronized in real time. As an outcome, no conflicts can occur. Carina can do her work on any device at any time and at any place. What used to be 100+ hours of work for Carina is now reduced to a few hours, and even the 2 employees in the back end can now focus on more important tasks, such as the patient's well-being. Nurse Andres can also do his admin tasks much easier and more efficient, as he always has his working schedule in his calendar, available from anywhere. He can use the employee version of the scheduling application and see for himself if a swap of a shift is possible, using a mobile phone, tablet, or even a home PC, to put forward a change request to Carina for approval. Despite the fact that Carina is off-site on a management training, she can approve or reject Andres' request using a device at hand. Once the approval is done, the system automatically processes the changes in Nurse Andres' schedule to payroll, making sure the change in shift is reflected on Andres' payslip. Finally, Mittköping Hospital and Region Mitt, with the help of Microsoft Dynamics 365 and Microsoft Power Platform, can benefit from having updated schedules and employee information in real time, with appropriate levels of information access for all employees to create tasks or make changes and updates. Most importantly, the new application has reduced the burden of manual work, reducing the amount of errors and free up time for medical staff to focus on what they were hired to do, to treat and look after the well-being of their patients.